Evening, everyone. Welcome to the discussion hosted by Scientific Scholar. I'm Dr. Sunny Datta Gupta, Publishing Director at Scientific Scholar, and today we bring to you the launch of our new unique journal addressing a very sensitive topic, the Journal of Transgender Health and Gender Affirming Care, belonging to the Association of Transgender Health in India. I welcome my fellow panelists, Dr. Sanjay, Dr. Richi, Dr. Bella, and Teya, along with our CEO, Mr. Pritesh Seth, and would request the fellow panelists to introduce themselves.
Thank you, Dr. Sunny. I am Air Commodore Dr. Sanjay Sharma. I took voluntary retirement from the Indian Air Force after serving for 30 long years to set up this Association for Transgender Health in India. I am the CEO and Managing Director of Association for Transgender Health in India.
Thank you, Dr. Sanjay. Dr. Richi.
I'm Senior Director and Head Department of Plastic, Aesthetic and Reconstructive Surgery and Gender Affirmation Clinic at Fortis Hospital, Shalimar Bagh, Delhi. I'm also the co-founder, Association for Transgender Health in India, and Chief Editor of the Journal of Transgender Health and Gender Affirming Care.
Thank you, sir. Teya.
My name is Teya. I'm one of the founding directors of the Association for Transgender Health in India, as well as I'm on the board for the journal. And I think that's about it. I bring with myself several years of experience of diversity, equity, and inclusion, as well as employer branding, along with, of course, having a keen lived experience within this field. So, yeah.
Thank you, Teya. Dr. Bella.
I'm Dr. Bela Sharma. I'm Additional Director, Internal Medicine, Fortis Hospital, Gurgaon. I'm also one of the founding directors at the Association of Transgender Health in India. I'm also Medical Director of Indian Association for Transgender Health and one of the board members of the journal.
Thank you, ma'am. I will now go back to Dr. Sanjay. Congratulations, sir, on the launch of the new journal. Before we talk more about it, I would like to request you to please tell our audience the background of the society, its origin, history, aim, and why you choose us, Scientific Scholar, as your publisher.
So, Association for Transgender Health in India was incorporated on 1st November 2018. And we started with a vision of ensuring that gender expression uh, get the respect and dignity that is due to them from society, and definitely have an opportunity to get the right kind of health care. And with that, we set out to, set up our professional arm, which is called as the Indian Professional Association for Transgender Health. This is aligned with the World Professional Health, World Professional Association for Transgender Health, popularly known as WPATH. And we provide a platform for the professionals who are working in the field of transgender health to learn and interact with people who have the lived experience of being transgender and gender diverse, as well as people who identify themselves as persons with intersex variations. So this is from where we started. So we have also been working with the Ministry of Health and Family Welfare. Mainly, we started with NACO, and then started interacting with the Ministry of Social Justice and Empowerment. We are very closely associated with the Center of Excellence for Transgender Health, which has been established at All India Institute of Medical Sciences. And presently, we are conducting a structured training and capacity building program for holistic delivery of care to people who have the lived experience. Uh, why we chose Scientific Scholar as the journal which we to sort of promote our philosophy was because our philosophy aligns with your philosophy of uh, learning and sharing, and that is what attracted us to the scientific scholar. Needless to say, also what impressed me was that you have more than uh, mm, uh, uh, 2000 plus editors and close to 2 lakh plus peer reviewers. And with that kind of a space which is already there, I am sure that our mission goal of reaching out to the professional to educate them and for them to share their clinical knowledge would be very well served through this journal. And that was what was the driving force for choosing scientific scholar.
Thank you, sir. I would now like to ask Dr. Bella, as the key member of the editorial board, how are you going to conduct the peer review process?
See, this is going to be a first journal of its kind. So we need to maintain the authenticity of the articles. We need to maintain the sanctity of the journal, which is very important. Each article needs to be reviewed very, very carefully. And it is going to be a double blind review so that both the reviewer and the author are anonymous. We have been in this field for now more than 6 years, and we do have a huge network of professionals, both in our country and abroad, like from WPATH, ATI, AIMS, and a number of other organizations. And these are the people who have been in this field and they have been experts. They have been working in the field for a much longer period also, especially like for people from WPATH. So we're going to make sure that each article that is published is reviewed very critically, and we make sure that it is authentic, and everything that we do publish in the journal makes an impact, because that is what this journal is all about.
Thanks for the insights, ma'am. I'm sure that while using our in-house portal, the very famous editorial assist, which actually has been designed by our CEO, Mr. Pritesh said himself, it's our in-house portal and is loaded with all the modern technologies and is tailor-made to conduct ethical double-blind peer review process. The journal will definitely progress in leaps and bounds ahead. And excellent insights from you. I will now move on to Taya. Taya, as the key member of the society and board member, how you think this journal will contribute towards the aims and objectives of the society?
So thank you so much for the question. I think, am I audible properly?
Yeah.
Yes, please.
Yeah, excellent.
Yes.
I think that one of the ways in which a journal like this contributes, right, it's that we look at the field of transgender medication. It's still, or transgender medicine is still a fairly new and emergent field, right? And what we aim for is the proliferation of care that is womb to tomb, right? From the absolute start to the absolute end of a human being's life cycle. We're looking to provide gender affirming care that is also standardized, much like any medical practice across the world. We want this process to also be standardized, to be peer reviewed. We want that the best possible care and also the most cutting edge care is reaching to people that need it the most. And I firmly believe that one of the ways to do that is through a peer-reviewed scientific journal where a community of folks can keep themselves accountable, keep themselves informed, right, and keep that sense of community still going. Sorry for rambling, but just the last point is what this also does is it provides sense of legitimacy to the larger medical fraternity, right? And it stops being something that is considered to be a fringe science, or considered to be a practice that caters to a smaller population of people. So I think, yeah, uh, through this, I think we can see that our aims would be, met when we align ourselves with the larger scientific society at large.
Thank you for your insights. My final question for the panel is for the captain of the ship, that is the editor-in-chief, Dr. Ritchie. Dr. Ritchie, sir, as the editor-in-chief, how you think this journal will contribute towards improving the healthcare of the society, and what message you have for the potential authors?
So, this journal will serve as a platform to bridge the knowledge gaps. Like it can provide regionally relevant research and clinical data from India and other unrepresented geographies,
We have lost yours.
bridge the global understanding. Also, it will help promote evidence-based care by publishing rigorous clinical studies, case reports, reviews, and guidelines on gender-affirming care. Then we will highlight it will help in highlighting legal and social contexts. Actually, India is quite ahead in legal and social field as far as the field of transgender and then gender diverse persons is concerned. So the journal can illuminate the intersections between healthcare, social justice, and legal frameworks. Then it will help foster the global collaboration, encouraging perspectives from diverse healthcare systems. And we already have many editors globally who are globally positioned, and we can have a global perspective as well. And it will help in consensus building in transgender medicine. Then the journal will help advocate for healthcare equity, which is an important and often underrepresented part subject in many of these previously existing journals. So my message to potential authors would be that your work matters. Every well-conducted study, clinical insight, or policy analysis that you contribute to has the power to improve lives and transform the healthcare landscape for TGD people, transgender and gender diverse people. Then global and local perspectives are vital. Share both your global insight and local experiences. Their unique cultural, legal, and healthcare system contexts enrich our collective knowledge and guide the future tailored interventions. Then commit to ethical and inclusive research. Ensure respect, confidentiality, and inclusivity in your research designs and reporting, reflecting the dignity and diversity of gender identities. Then collaborate and innovate, engage with multidisciplinary teams, and embrace innovative ideologies and methodologies. And be champions for change. Use your scholarly voice not just to advance the science, but also advocate for social justice, reducing stigma, and promoting health equity. So the journal aims to become a beacon of excellence, inclusivity, and impact, bringing together global expertise to shape a future where gender affirming care is informed, accessible, and compassionate. And your contributions can be a vital part of this transformative journey. Yes, thank you.
Thank you, sir, for your views and insights. And I'm pretty sure our audience and the potential authors would benefit a lot from this. My closing the discussion, I would now like to ask Pritesh, as the CEO of Scientific Scholar, how proud you feel that Scientific Scholar becomes the first ever medical publisher in India to ever launch and publish a journal and addressing transgender health. What are your thoughts about it, and how Scientific Scholar will take this journal forward?
Thank you, Sunny. And thank you everyone to join this initial launch of the journal on transgender health. To answer your question, Dr. Sunny, launching a journal dedicated to transgender health is a meaningful milestone. And as a publisher, we are proud to support this important initiative. While the editorial vision, content, decisions, and academic directions lie entirely with the editorial board, our role as a publisher to provide strong publishing infrastructure that helps the journal to grow and reach the right audience. Going forward, Scientific Scholar will ensure high quality production, global visibility, ethical publishing standards, and a smooth manuscript workflow. We will continue to support editorial team with the tools, technology, and platforms they need to build into a leading resource on transgender health. Once again, we look forward to work closely with the entire editorial team and making this journal a huge success and reaching to its milestone that behind this launching this journal. Thank you, everyone.
Thanks, everyone. Have a nice day.